Some people are so clearly autistic and so clearly have ADHD or OCD, and you might be thinking to yourself, how did no one ever tell me? How did no one ever catch the fact that I was ADHD, OCD, bipolar? Like, how did people not catch it? Not only some students, but some of my friends kind of grow up and they're like, how did no one tell me that I was autistic? How did no one know I have so many of the signs? And I'll let you know how this happens frequently. And it's actually very sad that this happens. Parents have good intentions, and sometimes they make mistakes. And one mistake that I see parents do a lot is that their child is flagged for something like ADHD or autism at a very young age, like 2 or 3 or 4. Very, very young. So the student is immediately given services, immediately put into speech, immediately put into occupational therapy, immediately see a learning specialist like me. And then the student gets slightly better. And with that ounce of getting better, they don't have the official diagnosis yet. They're just at risk for a diagnosis of autism, ADHD, OCD, language processing disorder, dyslexia, dyspraxia. They're just at risk for it. They're not diagnosed yet. So the student is automatically put in services. Even though they don't have the diagnosis, they're put in services already. And then the student gets slightly better. And instead of the parent keeping the student in those services, the parent decides, see, this is proof that my kid isn't autistic. This is proof that my kid isn't dyslexic. This is proof that my student doesn't really have ADHD. See, they thought they were autistic, they thought they were OCD, but see, look, they got help and now they're better. So it probably means that they're not autistic or they don't have ADHD. In actuality, it actually proves the opposite, right? The fact that you gave them help and that they got better proves the fact that they likely have the diagnosis. But parents then say, no, my kid doesn't need this help because they aren't this thing. And they pull the support away and they never talk about it ever again. And then 10 or 15 years pass, and the kid, who would have been fine if they just got the support they needed from the first place, starts noticing all these issues. Socially, they don't see things the same way. They don't read the same way. Things sound different to them. Their body moves in a way that is different than other people. And the parent is like, well, you were never really diagnosed. It's just they thought you might have been, but you got better. We gave you speech. It was fine. We gave you occupational therapy. You saw a learning specialist for a couple months and you were okay. No, you got better, but still neurodiverse. You're still autistic. Still have ADHD. Still dyslexic. But your parent wanted you to be, quote, normal. So they gave you a little bit of support, and then when they convinced themselves that you were fine, they pulled the support away and never talked to you about it ever again, hoping that the problem would go away. But the problem does not go away. So case in point, this is how a lot of people come into my office being like, I have all the signs of ADHD, autism. Why did no one tell me? Well, they told you very early. It's just then they ignored it because they wanted you to be better. And really, you're fine the way you are. I hope this helps.